So, Professor, thank you for talking to us on the record on this very important topic. For the sake of our audience being more informed, please introduce yourself briefly and tell us about your expertise.
Sure. I'm Professor Frank Oberklaidt. I'm a pediatrician. I am what's called a developmental behavioural pediatrician, so I'm trained in child development and behaviour. And I run a large academic centre in Melbourne, Children's Hospital in Melbourne, with a focus very much on prevention and early intervention, and particularly in the early years. And I'm very much influenced by something I heard one of my mentors say many, many years ago when I spent some time in Boston. He said, every time a child is admitted to hospital, it represents a failure of the healthcare system. So the corollary of that is, what went wrong in the community that this child needed tertiary care? And the corollary of that is, how can we be working with parents and with community providers and with communities to stop children getting sick? Or if there are issues, to pick them up as early as we possibly can. And more recently, our focus has been on the first 5 years of life, because the research is so overwhelming now about the importance of those years before a child goes to school, not just having an impact on the child's learning and behaviour and development, but indeed having lifelong implications.
Tell us a bit more about this correlation, about the first years of a child's life and how they reflect on the later experiences.
So the research tells us that the young child's developing brain, the first 2, 3, 4 years of life, is exquisitely sensitive to the environment. So for a child to develop according to his or her potential, they need good nutrition, they need protection from infection, that's why immunisation is so important. They need safety, so that there are no injuries, but they particularly need responsive, warm and predictable relationships. So that the genes that a child is born with, that's really the manual for child development. But the way development unfolds is almost entirely dependent on the quality of the environment, and particularly on the quality of the relationships that a young child has with parents, with the extended family, with caregivers and so on. When those relationships are dysfunctional, for example, when there's extreme poverty or there's extreme stress in the family because of unemployment, where there's parental substance abuse, where there's child abuse or sexual abuse, where the child is exposed to family violence, what the research tells us is that stress levels go up in a child's brain. And where stress is consistent, where the child is continually exposed to a stressful environment, stress hormones continue to be there in a prolonged way, and that interferes very significantly with optimal brain development. And what happens now is that it resets all the body's physiology. It resets the neuroendocrine system, it resets the cardiovascular system, and makes that child so much more vulnerable long-term to what happens the rest of the life. So if we project into adult life, and we look at some of the challenges that every country faces in adult society, from mental health problems, crime participation, family violence, chronic unemployment, diabetes, heart disease, stroke, hypertension. Many of these conditions have the roots and pathways that begin in those early years. So the research is crying out to us that if we really want to improve outcomes in adults, we have to start in those very early years.
If we already have such impressive amount of research, how would you explain that societies and authorities, people at large, still don't seem to fully understand that investment in a child, in the child's early development, is actually investment in the whole society?
That's exactly, well, in every country, not just in Bulgaria but in Australia, we all have difficulty convincing government policymakers, and there are several reasons for that. One is that it's invisible. What we're trying to do is to build capacity in parents, build capacity in families, build capacity in communities, and it's invisible. You can't point to a building. You can't point to the employment of another dozen social workers or nurses. So that's the first thing. Secondly, it's a long-term view. Not only is it invisible, but you're saying if you invest now, you'll see payoff in years to come. And in most countries, politicians don't like to wait. That you're asking me to invest and somebody else in 10 years' time is going to see the benefit. That's a very sophisticated ask. But you're right, that the key to a prosperous society, the economic key to the success of a country, depends on increased investment in those early years. So we have to get much better at framing the message. We have to get much, much better at explaining to the community, to the media, to politicians that increased investment in early childhood is the best investment that any country can make.
The visiting nurses program, the idea of home visitations, is it such comprehensive and a good approach? Because you had a presentation here in Sofia. Part of the things you said that even if we have and families have services at their disposal, often enough they are fragmented. Is the visiting approach, the home visiting service, such good practice in such direction?
Yes, it's a very good idea for a number of reasons. I said last night in a program that children are not born with a manual. If you buy a television set or a refrigerator or even a telephone, it comes with a manual that tells you what to do. Children are born without a manual, so lots of parents, well-meaning parents, all parents want to do the right thing by children. Some don't know what to do. They don't know what to expect in normal development. If the child is crying, they don't know what to do. So home visiting is important as a source of information for parents, number one. Number two is that it connects them up with existing services. So you're quite right, just because services exist in a community doesn't mean that people use them. And we have this notion in epidemiology called the inverse care law. Those who would benefit the most from services are the ones that are least likely to access them. So I think it's important for home visitors to act as a source of information to parents, to be a trusted advisor. So good home visitors will develop close relationships with parents, and they can pick up in the child's home signs of stress, concern about the child's development, issues to do with the family, and because they're in a trusted position, because they have a relationship with that family, then they're in the position where they can make informed referrals to get the support that many families need.
Can you tell us, based on your impressive career, be it regarding home visiting or any other early childhood development intervention, can you share with us some examples that impressed you the most, let's say, a progress that a particular child or a family has made and you have witnessed it and you were even more inspired?
Yeah, sure. I think as a clinician, and I still see patients a couple of sessions a week, mainly with developmental and behavioural problems, it's unusual for me to see a child and I don't have the thought, I wish I could have seen this child earlier. In other words, by the time they get to me, these problems are often entrenched. And there are a myriad of good news stories where families are stressed or single parents, they make contact with a very critical, important person in their lives. It might be a home visitor, it might be a preschool teacher, it might be a community nurse. But that person sort of unlocks that parent's potential as well, and so they get the services they require for their child. They're reassured about their parenting, and the child blossoms, turns out to really do very, very well. But the converse is true too, and that's what's worrying. There are so many young children who don't get that sort of help that they need. There are so many parents who struggle, who don't get the support that would really make a difference for them. And often it's because they face barriers in accessing the services that are there. There are physical barriers in terms of transport, they can't get there. The hours of opening may not be suitable. There are cultural barriers. There's a whole series of barriers that prevent parents and families and children getting the services that they need. So what I would like to see in the future is a world or a community or a society where every child fulfills his or her potential. And we know that many children don't fulfill their potential because their families don't get the support that they need. And I think one of the outcomes of a universal home visiting program is it starts to address that need. It starts to address the fact that lots of parents who would benefit from support at the present time don't receive it.
But in order for a child to reach her or his full potential, isn't it better if societies focus more on preventing the problems that a child or a family is coping with? Because you said it yourself, by the time a child reaches a specialist like you, he or she already grapples with some problems.
Sure.
But if societies, authorities, parents, experts focus more on curbing those risk factors and not coping with the consequences, please explain to us how this whole matrix, this whole philosophy should be reversed.
Well, prevention is a very hard sell in every country in the world. Those of us interested in prevention tear our hair out sometimes when the research is screaming out to us that prevention is the only game in town. It's not just effective, but it's cost effective. Why can't policymakers understand that? So it's a very hard sell. But we do know, and we've known for a long time, the sort of family variables, the parent variables, the community variables that make a difference to children. We know about the importance of good nutrition, about immunisation, about children growing up in households that are supportive, etc., etc. We've also known for a long time the various risk factors in the child and the family and the community. And you're absolutely right. This is not magic, but it's harder than magic. If we could identify the risk factors and try and eliminate them as soon as we can, or where problems do emerge either in the child or there's evidence of dysfunction in parents or stress in families, if we could identify those as soon as we possibly can and then intervene, then that's the best chance of a long-term outcome, of course. And that's why we need a holistic approach to child development. We can't lay this on just the health sector, or just the education sector, or just the welfare sector. Everywhere where a child and family makes contact with the service system, that should be the right place. No wrong doors anywhere in the service system. So even if I can't help you, I know there's something going on, and I can refer you to somebody who can help you. And what's more, I'll take responsibility for the referral. And the example I often use in my country is the issue of sleep problems in a toddler and a childcare worker. Now, you wouldn't expect an early years professional to know what to do about sleep problems. They're not trained clinically. But in an ideal world, you might expect that early years professional to notice that this mother is looking very tired and to say, "Are you okay? The last few weeks you've looked very tired and stressed." And the mother says, "Oh no, you know, my toddler is up all night and I can't sleep, and my husband's not getting sleep, and he's angry in the morning and there's terrible tension." And if the community is properly organised, the early years worker will say, "Do you know that there's a GP or a paediatrician or a psychologist or somebody just up the road? They can help you with the sleep problems. Would you like me to make the appointment for you?" And while the mother is there, the early years worker makes the appointment. Next Thursday at 10 o'clock, does that suit you? Okay. At the end of the day, when the mother comes to pick up that child, the early years professional says, "Did you keep that appointment today? Oh, you couldn't keep it? Never mind, we'll make another one." So that's me as somebody who comes into contact with a child and the family. I don't know what's going on, but I know there's something not quite right. And first of all, I notice there's something not quite right. And secondly, I take responsibility for doing something about it. That's an organised service system.
That sounds really reasonable. I hope that many people will hear and try to implement such approach.
It's not rocket science, is it? But the idea is there's no wrong doors.
Yeah.
Everywhere you come with your child, you've come to the right place. Even if I can't help you, I'll find somebody who can, and I'll take responsibility for making sure you get there.
Please imagine for a second that I'm a young parent, a confused young parent who doesn't know exactly how to handle his or her newborn baby. You said it yourself, children don't come with instructions. Can you please give for our audience some universal pieces of advice? For instance, I have friends who refuse to read stories to their babies or to have conversations with them because they say, oh, it's a baby. He or she doesn't understand anything. It's just a baby. Can you tell those people some meaningful ways to engage with their newborns and young children, because you said it yourself, the brain develops most rapidly during those first years of life.
Well, relationships are everything. From the time that they, from the time the baby is born, the baby needs to hear language, needs to hear laughter, needs to hear singing, needs to be read to from a very early age. So you, in a way, your friends are right. The baby doesn't understand the language, doesn't know books, but starts to become used to the sound of the parent's voice. And the brain is programmed, the genes program that part of the brain to start to develop language by hearing voices. Excuse me. And it doesn't have to be, there's nothing magic about this. While they're changing the nappy, they can be singing a song, they can be talking to the baby. And you're quite right, babies don't talk back. But if you watch a baby from as young as 1 or 2 or 3 weeks of age, they'll look at the parents, they can hear the voice. There's this magic of a mother-father-baby interaction. And once parents understand that, if you can turn them on to the idea of the baby responding, the baby's not a passive recipient of everything that happens. The baby actively engages the parents, looks to engage the parents. And the dividend, the payback to parents of investing in that relationship are just profound. So one of the important things you can do to your friends is just alert them to the fact that there's so much joy, there's so much ecstasy to be gained by interacting with young babies. They can get into that magic of what it means to be a baby, what it means to be a parent of a baby, what it means to be so madly in love with something that you've produced.
Talking about this joy of engagement and seeing a baby blossom, can you tell us, looking back at your extensive career and very impressive know-how, how has this whole work with families, with children, and as a researcher, how has this affected you as a person? What kind of a person has this career made you?
Well, that's an interesting question. How much time do we have? I think more than anything, I feel extraordinarily privileged to have spent my career working with children for lots of reasons. But to be trusted by parents with giving advice, or to be trusted with the most precious thing in their lives, is very, very humbling. And I tell my medical students that, I tell my students the privilege that you have of being allowed into a family life where they raise their greatest concerns, their biggest anxieties. Don't ever abuse that. But the other lovely thing about working with children is you can't be arrogant, because every now and then when you think you've got life handled, a child will urinate on you or will vomit over you, and that just brings you back to earth very, very quickly.
Okay, thank you so much.
Thank you very much.